I'm going to be answering the top 5 questions parents have about what to expect when you take your child to the dentist, including the most popular dental procedures, how to prevent cavities, and much, much more. And at the very end of the video, I'm going to give you my top tip for what to say to your kid before they get any major dental procedure done. So when should you take your kid to the dentist? It's typically recommended to visit the pediatric dentist when their first tooth erupts, which is around 6 months to 1 year of age. A lot of parents might ask, isn't that a little bit too young? But the reality is that kids can start developing cavities as soon as their first tooth erupts. That can lead to pain, infection, or even worse, early loss of a baby tooth. But who cares, right? If a baby tooth is going to be replaced by an adult tooth, why does it even matter? Well, baby teeth have a lot of important functions, including helping your kid chew food to get proper nutrition, and even more importantly, in my opinion, is maintaining the space for their adult teeth to come in. In fact, these kids that lose their teeth early usually have major orthodontic problems later on in their life, including major crowding or severely crooked teeth. And I should probably also mention that if a baby tooth gets a large cavity, it can infect the nerve, travel down the nerves, and affect the adult tooth that's planning to replace it. What should you expect at your child's first dental visit? The first visit is meant to get a comprehensive look at the state of your kid's oral health. We examine the teeth, jaws, gums for proper structural development and to just make sure your kid is healthy. We review how to maintain your kid's teeth, including going over proper habits like how to brush teeth the right way, or using a reduced sugar diet and making sure that you're drinking lots of water throughout the day. If it's their first visit and they are very young, typically a visual examination is more than enough. But if there's any cavity present, then typically we need to take an x-ray of the tooth to evaluate the extent of the cavity and to see what type of treatment is needed to restore the tooth back to health. Finally, a kid's cleaning will be done by the doctor or the hygienist using a rubber prophy cup or hand scalers if there's any tartar or calculus on the teeth. If everything checks off, then we simply have them come back for their routine cleanings to make sure that no cavities start to develop over time. So what if you have a kid that is incredibly nervous or anxious about getting a cavity filled or getting a tooth extracted? While I personally prefer to work on kids without sedation, there are many times where kids may be uncooperative because of a very normal fear of going to the dentist, and it's just not possible to get the treatment done the right way without some level of sedation. And for these cases, there are a variety of sedation options depending on the cooperativeness of the patient and the extent of the treatment needed. Nitrous oxide, also known as laughing gas, is a very popular and very safe sedation option for kids. It is a mild sedative agent that is administered through the nose, and it uses a combination of nitrous oxide and oxygen to ease the kid's anxiety during the dental procedure. They will typically feel more relaxed and comfortable, but they will be awake the entire time and breathing on their own. The nice thing about nitrous is that it is easily controllable and it wears off pretty quickly. So after the procedure is done and we turn off the nitrous and put them on oxygen, typically they will feel pretty normal immediately after they leave the office. Oral sedation is a stronger option for kids that are a bit more uncooperative and need more extensive treatment. It is typically delivered as a medicine that you drink, and it helps the child feel more relaxed and a bit more sleepy. But the kid is still very responsive and is able to move and respond to any questions that we might have. Finally, IV sedation and general anesthesia are the strongest sedative options that will basically put your child to sleep during the procedure. An anesthesiologist will closely monitor the vitals while the dentist works, and typically these sedation options are reserved for those patients that are very uncooperative, that have an extensive amount of work. I'm talking about a cavity on almost every single tooth, where it's not reasonable to have the patient come back time after time after time, or if the other sedation options just aren't working for the kid. So that's when we reserve this type of sedation for those type of patients. So now let's talk about what the different types of dental procedures we do on kids and why we do them. Dental sealants is a preventative procedure done to help kids maintain healthy adult teeth throughout their adolescence. When your adult teeth first erupt, you have deep valleys that can trap sugar and cause cavities to develop if it's not properly cleaned. A sealant is a flowable resin that is placed over these deep grooves to make them more shallow, which will make it more easier for your kids to clean their teeth. We typically do this with minimal drilling and no anesthesia, and after we clean the tooth with a prophy cup and antibacterial solution, we will bond the sealant onto the tooth. Dental fillings are another popular procedure done to help eliminate small cavities. Now remember that baby teeth are going to be replaced by adult teeth, so a lot of times we have to decide whether it's worth it to do a filling on a baby tooth or whether the adult tooth is eventually going to replace the baby tooth before that cavity becomes a problem. And your dentist will make that decision by looking at the x-rays, seeing the mobility of the tooth, and making a decision as to whether we should do the filling before it becomes a root canal and the kid has pain, or whether we can leave it alone and wait for the succedaneous tooth to eventually replace it. Stainless steel crowns are done for kids that have larger cavities, where a dental filling is not enough to protect the baby tooth. It's essentially a prefabricated crown that is adjusted in the office in order to fit your kid's teeth more appropriately. A lot of times these stainless steel crowns are done in conjunction with the last procedure I want to talk about, which is a pulpotomy or baby root canal. This is typically done if a cavity reaches the nerve of the tooth, and if it reaches a nerve, sometimes that can cause pain or an abscess can develop on a baby tooth. It can be really uncomfortable. And what we basically do is remove part of the nerve chamber of the baby tooth, which will eliminate the pain, eliminate a lot of the infection, and then you place a stainless steel crown on top of it. Now, if a tooth is bombed out completely and it just can't be saved with that partial root canal, then we decide to do an extraction and place some type of space maintainer appliance in order to maintain the space to allow the adult teeth to come in the right way. So the last question I get often is, how do I make sure that my kid has a good experience? And this is actually my biggest pro tip to parents that are taking their kids to the dentist, is that you don't want to overhype the procedure. You don't want to transfer your own anxiety to your kids, because they can sense that anxiety and then that gets them anxious for the procedure. So try to avoid trigger words like pain, or they're gonna give you a shot, or stay strong, you can do this, because that immediately notifies them that, or alerts them that something is gonna be wrong during the dental procedure. The best thing to do is just to simply say, you're gonna go to the dentist, they're gonna check on your teeth, they're gonna clean it, maybe they'll clean out some sugar bugs for you, and they're gonna make you healthy again. Keeping it very simple, plain language, just makes it easier on the pediatric or general dentist, because we have our own ways to control their anxiety, whether it be through sedation with nitrous oxide, whether it be through tell, show, do, where we tell the kid what we're gonna do, we show them what we're gonna do, and then we actually do it. Whether it's gonna be through distraction techniques, there are a variety of ways that we as dentists can help manage that anxiety, so it's important that you don't transfer your own anxiety to your kids. Also, try to schedule a morning appointment. Kids are usually more cooperative in the morning versus the afternoon appointment, where they get a little bit more wiggly. And of course, if they have a favorite toy or a stuffed animal, you might as well bring it with them if it makes them feel more comfortable. If they have an older sibling, typically we like to work on the older sibling first, and the kid can watch, depending on if that older sibling is cooperative. And these little tricks will make it more of an enjoyable experience. So I hope this video helped any parents out there that may be taking their kids to the pediatric dentist or general dentist soon. I hope you have a great experience with your kid, and I'll see you for the next video where I talk about jaw surgery. Thanks, and see you next time.